The impact of COVID-19 is far-reaching. Isolation, business closures, the loss of loved ones. But now, a new report shows your brain is also at risk. It's the biggest study of its kind so far and found even mild illness may have a dire consequence for the brain. Professor Maurice Curtis, head of the Auckland University's Anatomy and Medical Imaging Department, was shocked by the findings and joins us now. Morena, Professor Curtis, thank you so much for joining us. Shocking but fascinating research that's been done here, right?
Yeah, absolutely. It is surprising to see such an impact on the brain, even a relatively short time after people have recovered from COVID. So in this study, a UK biobank has had a look at those that had an MRI study, about 785 people in 2018 or 2019, and then subsequently scanned people who had COVID or didn't have COVID and looked at which regions of the brain were affected.
Wow. And what did it find? What did this research tell us about how COVID might affect the brain?
Yeah, a couple of key things came out. Firstly, the olfactory systems, which allow us the sense of smell, but also the memory centres of the brain were affected. And on average, they were reduced in size by about 2%. But some key areas that connect those regions were reduced in size in those that had COVID by up to about 6%. The other thing that it found was that people who had COVID performed worse on cognitive tasks and executive function tasks and searching tasks, where they had to search for different things on a page. So it is concerning.
Yeah, the brain is a fascinating thing. And I guess this speaks to just how far into the pandemic we are, that we're able to look at this kind of thing, right?
Yeah, absolutely. So the average time between the person having COVID and having the second scan was about 140 days. So more and more we'll expect to see data coming out of what the long-term effects are of having had COVID. We've known from previous pandemics that actually affecting the pandemics or these viral illnesses can affect the sense of smell and also some of the memory centres. So perhaps we shouldn't have been so surprised.
Yeah, I was looking at some of the research. With normal ageing, people lose a tiny fraction of grey matter each year, it says. For example, in regions related to memory, the typical amount of loss is between 0.2 and 0.3%. But with COVID patients, they experienced upwards of 2% of additional grey matter loss in different brain regions.
Yes, that's right. Yeah, and the interesting thing in this study was they compared a group of people who had had the seasonal flu but hadn't had COVID, and actually they didn't find that same loss in those that had had seasonal flu. So there is something worse about COVID in terms of its impact on your brain. The other thing that the study doesn't go into in great detail is whether or not the vaccination had an impact on reducing the amount of loss that you see in the brain because of the timing of the study, which finished up in about May 2021. So most of the people in the study wouldn't have been vaccinated.
And I guess it's a really interesting point to make, Professor Curtis, because, of course, the point that we're in the pandemic at the moment, lots of people do talk about the mildness of Omicron and possibly the links between Omicron and a common flu or cold or that kind of thing. But this is very different, right? We're talking about two completely different beasts and how it affects us in our bodies.
Yes, absolutely. So we don't know the impact of Omicron because this study would have been largely based around previous versions of the virus rather than Omicron itself. But I think anything that we can do to just reduce the impact of COVID on our body is likely to have an improvement or to have people will experience less reduction in this in the grey matter volume that's shown in this study. Although they don't explicitly say that, one would assume that if the disease has less impact on your body, then you'd see less of these changes on MRI.
Do we know why there would be such a massive difference between COVID and a seasonal flu in terms of how it affects the brain?
Yeah, we don't know exactly, but I think some of the good evidence suggests that when you lose the sense of smell, and the sense of smell is obviously you breathe air into your nose, and about 25% of the odorants in your nose pass over the olfactory system. And the olfactory system, I've got a plastic brain model here. The olfactory system is just that small area underneath there. And these are the nerves that are directly exposed to the outside world. But all of the cells that surround those nerves that allow us the sense of smell are the ones that pick up COVID and allow it to enter into the body. And there's other cells in the body that do the same thing as well. And we know that they become inflamed. And when they become inflamed, it then has an impact on the brain cells. And so that impact obviously has the ability to travel back through the neural circuitry that ultimately ends up affecting some of the memory circuits in the brain, which are a little bit further back. So again, that the way that that COVID enters the body is probably important for what the long-term impacts are. If it had a different route of entry, maybe the impact would be different.
This sounds really serious. Is it as serious as I'm thinking it might be?
Look, it is serious, and I think it's something that we need to follow. So this is one large study, but more studies will follow as time progresses past people getting COVID. But I guess it's not something to worry about as such. I mean, we can't change what's in the study, but I think it is important just to remember that some of the outcomes of this disease won't just be respiratory or a runny nose, etc. They'll be longer term. It may even be that in the future we find out that we find that some of these diseases are actually the root cause of other conditions like cognitive decline, dementia, etc.
Yeah, and a really timely reminder that we're not quite done with this thing yet as much as we would like to think that we are. Is there anything that people can do? If you've tested positive, is there anything that you can do to try and minimise the impact on the brain?
I think the usual precautions are good. So your brain doesn't like high temperature. Your brain doesn't like high blood pressure. Those things are good to really keep an eye on. Not that necessarily COVID will cause high blood pressure, but those are good things to keep an eye on with regards to brain health. With regards to the cognitive decline side of things, certainly exercise and spatial navigation, going a different way to work, that sort of thing is really good for the brain. Even brain teasers, Sudokus, those kinds of things are really good for the brain. We don't know, because the research hasn't been done, whether that would improve the outcome for people that have tested positive and, for instance, those that engaged in this study. But we know that those things are good for the brain. We know that they're good for reducing cognitive decline. And so, those are practical everyday things that people can do for their brain health anyway.
Hey, we really appreciate your insight into this. And again, a really timely reminder that we should be taking this really seriously. So thank you so much for your time this morning. That is Professor Maurice Curtis from the Anatomy and Medical Imaging Department at the University of Auckland.